Hello, I'm going to talk about a nephrotic syndrome. Nephrotic syndrome is a damage of the glomerulus, the basement membrane of the glomerulus, and that allows the protein to leak into the urine. The reason for nephrotic syndrome can be an autosomal recessive disorder, which is a genetic disorder. Many times there will be a secondary nephrotic syndrome, and it may be any reason and which is causing damage to the glomerulus. So the damage to the glomerulus will lead to a protein into the urine. So basically, baby is losing a lot of protein through the urine, so they will have a protein urea. So the urine is a dark color and frothy because baby is losing protein, so baby will have almost no albumin in the blood, or very low albumin in the blood. Albumin is a protein, so because of that baby loses lot of fluid into the cavities, so that leads to a severe edema. Usually the protein maintains, the albumin maintains a colloidal osmotic pressure inside the blood vessels. When there is a decreased albumin, the colloidal pressures will decrease, and that will leak the fluid into the interstitial spaces and the cavities. So this baby will have a periorbital edema, is the eyelid edema. Have ascites, like there is a fluid in a peritoneal cavity, have a pleural effusion, so which will affect the airway. So if we talk about ABC, so airway, they will also have edema of intestinal mucosa, which can cause diarrhea, anorexia, and then this baby definitely are gaining weight because they are retaining all the fluid. These babies are very malnourished, right? But they look like they are healthy because their whole body is edematous. So never get confused. The other symptoms other than proteinuria and hyperalbuminemia and severe edema, they will also have a hyperlipidemia. We don't know the reason for that, but this baby will have this symptom. The treatment for this is the prednisone. Prednisone has been a very useful for nephrotic syndrome. Immunosuppression therapy also helps, and then when as a nurse we also check their intake output and also look into the skin, because their skin is edematous, their skin is very shiny and it will break very easily. So make sure we are turning the babies, they are heavy, they are edematous, but make sure we take care of their skin, and we give them a high protein and high calorie diet. Okay, so I'll end here my video. If you have any question, please contact me.